Nigeria is Africa's most populous country with 154 million citizens. Though rich in resources, its health indices are quite poor.
Before NURHI started, the maternal mortality ratio was 545 deaths per 100,000 live births in Nigeria. And the infant mortality rate was also high, 157 by 100,000 live births. And we have the neonatal mortality ratio, which is also 40. So indices were quite poor. And for family planning, the contraceptive prevalence rate was 10%. The total fertility rate was 5.7.
The NURHI project is a consortium of partners led by the Johns Hopkins University Center for Communications program with funding from the Bill and Melinda Gates Foundation. NURHI's goal is to increase modern contraceptive use to 20% points in 6 densely populated Nigerian cities: Zaria, Kaduna, Ilorin, Ibadan, Benin and Abuja.
The key 5 project objectives are integrating family planning services into existing healthcare services, maternal, newborn and child health, and HIV/AIDS, improving the quality of family planning services, developing novel public-private partnership and especially innovation in the private sector, developing interventions for creating demand for use and sustaining use of contraceptives, and also generating an enabling environment for funding mechanisms for policy implementation.
When the project started, it was a challenge for clinics to provide high-quality family planning services. Many suffered from years of poor maintenance. NURHI has developed an innovative program for rapid improvement to infrastructure and equipment inventories in these hospitals.
The 72-hour clinic makeover is one of the innovations developed by NURHI. On a Friday, after close of business, to avoid disruption of services, NURHI and the service providers in such facilities move in to now bring together the equipment supplied and then provide some facelift so that the clinic that closed in its usual old dilapidated state on a Friday opens up on a Monday morning at 8 a.m. in a renewed state.
So far, over 21 clinics have been made over in 4 cities. The impact has been remarkable.
The 72-hour makeover is a dream come true. Where I was before, I want to say that place was like a cave. I didn't have an ideal family planning session. I didn't have the insertion room. I didn't have the counseling room. Everything was just jam-packed. Sometimes my clients, I have to beg them to wait outside. They were coming one by one. They had no sitting places at all. The chairs were not comfortable. But now, everything that an ideal family planning room is supposed to have, I have it now.
Social mobilizing is key to generating demand for family planning services. Community volunteers go from door to door explaining, answering questions and speaking at social events. Referral of potential clients is then made with Go cards.
Dalilin da yasa ni ina son in ga kaina a wannan aiki na taimaka ma mata, yanda mata su kasance mata ne masu kula da gida gaba daya. So yana so mata ta dade a duniya saboda ta kula da yaranta.
NURHI has also created awareness and generated demand through radio and TV.
The media support have helped to remove that barrier
that people have about family planning, because the sports are entertaining, they're educative, and they are fun. So now we have more and more people going to facilities to ask questions and seek family planning services. We also have radio drama running across the 4 cities presently. They run weekly, and we have mobilizers that have been trained. They formed listening clubs to listen to the radio drama, and a mobilizer is usually the facilitator of the radio listening club.
Winning the support of political makers, political leaders and opinion holders has been the thrust of advocacy efforts at national and local levels.
When the project started in 2009, the environment around family planning was very, very negative. We established what we call the Advocacy Core Group, which served as the community voices, the voice of the community, the people, discussing, engaging in dialogue. We now have free commodity policy. People can easily discuss family planning. The political leaders, the religious leaders, the traditional leaders have spoken in support of family planning.
Introducing this family planning by NURHI has gone a long way to make the women in our society understand what really is family planning, and that they knew that there's no harm in it, because all the methods that are being used by the family planning were in line with what I read in one of the hadith.
It is in the plans of God that you give birth to children based on the number you can cater for, and also to keep those who are producing the children to be healthy.
Over a period of about 18 months of intervention, when we did the midterm, it's encouraging to note that cities where we thought traditionally there is resistance to the use of family planning are actually the ones that gave us the highest point in contraceptive prevalence rate. For example, in Kaduna, we had 15.5% point increase over that time, which shows there was silent demand which was not met. In Ilorin, we had about 11.6.
In terms of midterm results, to learn that 83% of all the women had exposure to our Get It Together communication, interventions and material, I think it's something that is heartwarming, which means we are reaching out to our intended audience, talking about the urban poor in Nigeria. Intention to use family planning, from what the midterm result is saying, is increasing.
People are now aware that for quality of life to be improved, family planning is one of the key interventions. Furthermore, Nigeria has ascribed to meeting the MDGs and is put all policies and actions into place to ensure that accelerated interventions are made for meeting MDGs by 2015. Family planning is one of those core interventions, and now all sectors realize that family planning actually is beneficial to attaining the goals and objectives. I see the future of family planning very bright in Nigeria.